Good morning. So our first outdoor press conference or discussion for COVID-19. A few things that I'd like to say, and then we'll open it up for questions from the group. So first of all, where are we here in the Triad and in the state with the COVID-19 outbreak? Well, the numbers of cases that we're experiencing here in North Carolina continue to increase. If the numbers aren't quite out yet this morning, but we'll be above 1,000, I think, here in the state. By far and away, the part of the state that is really wrestling the most with COVID-19 remains the Charlotte-Mecklenburg area. And I get asked why. Why is it that Charlotte is having the most trouble with it? And some of it is just common sense. It's bigger. There's more people, and they're going to have more infections. The second part of it has a little bit more to do with population density. So their population's concentrated a little bit more than in other areas in North Carolina, including here in the Triad. We're a little bit more spread out here. And you can see that across the country, those areas that have the highest population densities are having the most trouble, and that include New York City and such. The other thing about Charlotte is Charlotte's started moving up the hill of the epidemic curve a little bit quicker and earlier than where some other areas here in the state. And then social distancing and shelter in place was put in at a time when they were further up the hill of the epidemic curve than we were in some other areas. And as we'll talk about it in a minute, I think sheltering in place is working, and I think it works best before you start to climb the hill rather than once you're up climbing the hill. And so those are all some reasons why I think it's affecting Charlotte more. Will other areas of North Carolina follow Charlotte? Well, time will tell, and we'll see. The Triangle region is somewhere between the number of cases we're seeing here and then what they're seeing in Charlotte. So here in Forsyth County, we have roughly 50 cases now total that we've seen. A little bit more in Guilford County. They're going to probably be around 60 or so today. The North Carolina numbers can usually come out to noon, so I'm estimating a little bit. The hill that we're climbing is a little bit more of a foothill right now than a mountain. If you want to think of Charlotte being a mountain, we're more of a foothill. I think we're going to see more cases still here in the area, but we're not testing really outpatients anymore, and we'll talk about why that is in a minute. So if people aren't sick enough to come in the hospital, or don't have special health problems that put them really at higher risk, we're not testing, and we're telling people to go ahead and have your flu at home and to do it there. And if you're not testing, we don't count as many cases. So we're using a few other things to keep track of where we're at on the epidemic curve, one of which is hospitalization. So the people you put in the hospital is sort of the tip of the iceberg, right? And so if you measure that tip of the iceberg every day, you can get an idea of the size of the iceberg itself. Right now, we have roughly 10 people in the hospital in our area that are from Forsyth County area. Guilford has a few also, and those numbers are much lower than in other places in the state, and obviously much lower than a lot of other places in the country. So why do I think right now we're not seeing as many cases here in the Triad? Well, one of them is having to do with we're not testing as much, and we mentioned that, but we're also not having as many hospitalizations. So I actually think our hill is a bit smaller. Will we end up getting more? Will we end up seeing a much higher peak later on? I hope not, but I'm very confident that what we're doing with social distancing and sheltering in place is working. We have data now from other places in the world, more data here from the United States itself. It is making a difference. And doesn't that make it a little bit easier to be going through some of the difficultness of our time right now? If we know it's working, I think it makes it easier. It's always better to suffer a little bit of pain when we know it's for the good of everybody, particularly for our vulnerable people. So I appeal to everyone, keep it up. It'll be a little bit of a marathon, but let's keep it up for a few more weeks for the good of everybody. I really think it's working. So a few specifics that I've been asked lately is, what about testing? Why does it take so long to get a test result back? Well, there aren't a lot of labs that are able to do it, and there are a lot of people who want them right now. More people want them, not as many places to do it. It just takes longer. We are prioritizing our testing here in North Carolina to people who are sick enough to be in the hospital, sick enough to be admitted to the hospital. And why are we doing that? Is because that's where it makes a difference, because it helps us to know what a person has when they're admitted to the hospital. It helps us with diagnostics, it helps us in management, and it really helps us with isolation in the hospital and saving our PPE, that personal protective equipment that we use to protect our healthcare providers. If we know who has the infection, then we can save our PPE for those people. The other group we're prioritizing it for is healthcare workers, so we can get them back to work in a smart way. And then lastly, for people who are vulnerable, either at the extremes of age or who have a lot of other healthcare problems. And so we're asking people who otherwise have flu-like symptoms, who would normally just stay home with their flu, is to just stay home with their flu-like symptoms. Could it be COVID-19? It could be. It could be the flu. It could be one another viruses that circulate around. But stay home for 7 days with 3 days of improvement. If you feel like your symptoms are getting worse, or you start having trouble breathing, or you're just so sick that you can't get out of bed, or other people are worried that you can't be your bright normal self, then that would be a time to call your doctor and to discuss your symptoms with them. And to see if you should be evaluated at one of the respiratory clinics. All of the healthcare systems have respiratory clinics set up. For ours here with Wake Forest Baptist Health, it would be 33670-COVID, and then they will tell you where the nearest one is to where you live. So for those people who the results have taken more time, by the time you get your results back, you're going to be better, I think, most of you. And that's okay, because no one likes being sick. And if you've spent your 7 days in isolation with 72 hours of improvement, you're released. You don't have to be isolated anymore. We're still sheltering in place, but you don't have to be isolated. Another question is that I've gotten about testing in the area. Are we getting more tests? Yes, we're slowly ramping up. And I get asked, why all the confusion? At first we're saying everybody go get tested, and now we're saying just the high-risk groups. Well, there's two reasons. One is that as we move further into our epidemic, we're trying to mitigate rather than contain, which means we don't have to know about every positive now. And the second reason is that we have been prioritizing our tests, as I mentioned earlier. Will we go back to asking everyone to get tested again? As we have a large number of tests available and we leave mitigation, as we start to come down the epidemic hill and we say, hey, it's time to start relaxing, maybe we can start going back to work, and we could maybe start thinking about doing some of those things that we like to do that are more normal. At that time, we might ask people who get sick to be tested, and then we would identify contacts and be a lot more strict about isolation as shelter in place is relaxed. And that is one of the potential exit strategies as we start to come down the hill. We still have some more hill to climb. and then we got to get up over the epidemic hill, and we got to start relaxing as we're coming down the hill. We don't want to relax at the top of the hill. And so that's somewhat maybe the testing strategy in the future. A few things about visitor restrictions. Hospitals are restricting visitors. Why do we want to do that? Well, we want to protect our patients from potential exposures, and we also want to protect you, the visitor, from the healthcare environment. So it's twofold. I understand as a doctor, just as much as everybody else does as a family member, how hard this is. I also understand because as a family member, and I've had people, loved ones in the hospital before, and so I know how important visitation is and looking out for your loved one in the hospital. And unfortunately, this is one of those things that we just have to do to protect everyone, and including our patients, and to protect you. I wish we didn't have to do it. Nobody wishes it more than me, but right now we do. So that includes labor and delivery, where you're allowed one coach, and in areas like our ICUs, unfortunately, those are the areas we have to be really strict about it, because that's where the potential exposures have the greatest risk. So that there's been a lot in the news lately about asymptomatic people who might have COVID-19, and if you haven't seen it yet, you will, because the national news is really honing in on this. And this comes from 3 reports that the CDC put out in the last week and a half. And it basically says what I've been saying all along. Yes, there are some people who probably don't have symptoms who do have COVID-19. Are these people a major driver of the epidemic? Likely not. No. They may have a part in household transmission from an asymptomatic person to another. It may have a component in certain close groups of people, like church groups and choirs and people who should be social distancing otherwise. But from just walking down the street, going in the grocery store, standing in the takeout line, if you're doing your 6 feet and social distancing, I don't think transmission from asymptomatic people is really an issue. The other thing is pre-symptomatic, so people might be shedding virus a little bit before they get their symptoms. Yes, this probably does happen. It's probably only a day or so before they do get their symptoms. And I think it's going to be important as we try to identify people and then get contact identifications down the road. But right now, if you are in a household and there are sick people, everyone should be either isolating if you're sick, and if you're quarantining, staying home, which means if you've been around somebody who is sick, you should stay home too. And that's to help prevent us from transmitting. So will we all be wearing masks in public? Maybe. The CDC's thinking about it, and it has to do with this pre-symptomatic transmission. If people might be or low symptomatic transmission and spewing out goblets of virus as they go out in public, would a mask help with that? And for sick people, it'll help contain it on them. Will it help you prevent it from getting it from another person? Maybe not so much. But you might see some interesting ways to make fashion statements coming out if more and more people mask. It may be like, high noon at the OK Corral, everyone wearing bandanas, or it may be fine silk scarves, or it may be masks with slogans on them. I don't know how it's going to come out, but stand by for that. The CDC's thinking about that, and that guidance might come out about us wearing masks when we go in public. And lastly, I want to make one appeal for people. Now is the time to support your local neighborhood business who is still open. There are a lot of restaurants out there who are struggling right now. Takeout is really cool. Takeout is totally kosher. Call ahead, have your food prepared, stop by, pick it up, practice social distancing while you're getting it. These places need our support, so maybe we can have a Takeout Friday where we can support our local restaurants or local businesses who are struggling to stay open to support us. So with that, I'll open it up for questions.
Dr. Earl, we're waiting to hear for those numbers from the state, but are you seeing any patients with different kinds of symptoms that we need to be aware of?
Yeah, so people are asking, are we seeing people with different symptoms? By far and away, the main symptoms of this still are fever and cough. And at some point in the infection, 90% of people have fever, and about 90% are going to have cough at some point. Early on, it may not be quite as prominent. Some other symptoms that might come up are diarrhea in about 30% of people. Usually, though, as time goes on, it's not the prominent one. It's not the biggest symptom. The other thing, sometimes people might have problems with smelling. We call that anosmia. But unfortunately, allergies can cause that, and almost any cold virus can cause that as well. So it's not very specific to COVID-19. And then lastly, I'd like to say is that elderly people, particularly those who have other underlying illnesses who are under the age of 7 or over the age of 70, might have more weakness, fatigue, general lassitude, and may not develop the fever or the cough right away, and may have more problems with shortness of breath. So it's to look out for a little bit for our vulnerable populations with those other symptoms.
In Montgomery County, we learned yesterday of sadly, the sheriff's deputy in SRO who passed. And he apparently went in thinking that he was going to an outpatient clinic for allergies. And then he ends up testing positive for COVID and Saturday night he's dead. That can be really scary for someone. What would you say about that back and forth of is it allergies or is it something?
Right, yeah, so, it's allergy season. I mean, we're outside. The pollen is all around us right now. Allergies generally are more upper symptoms. Sneezing, postnasal drip, and clogged sinuses. For people who have asthma, there may be a cough component to it. Fever is very uncommon with allergies, and sometimes people could get confused. The other thing that is very uncommon with it is shortness of breath. So if you're having shortness of breath, that's something you'll want to get evaluated for.
When we talk about here on campus about supplies, how is it going with supplies? Do you have a timeline for PPEs and for beds?
Yeah, so what about supplies and our supply situation with hospitals? Well, it's still tight. It's better than it was last week for some places. For other places, they're still struggling with it. And the thing is that we really appreciate, by the way, everyone who's come forward with donations. Dental clinics donating PPE and people knitting fabrics for cloth masks. We're starting to put those into place now to help to put on patients to help keep the virus to themselves. So these donations are very much appreciated. China's manufacturing starting to open up some. Supply lines are coming through a bit. Places in the United States are repurposing. And here in the Triad region, we're staying a couple steps ahead. In Charlotte, you'd have to ask them. I think they're having a little bit more trouble.
Can you talk about what is tight when things are tight? Is that
tight means is that we count them every day, and we keep track, and we watch them, and we look to see how many weeks supply we have of things. If we have more than a couple weeks out of supply, then we are a little bit more, feel more comfortable with it. If it's less than that, then we try to do other means. What we're not doing are things that would jeopardize the safety of our healthcare workers, and we're not skimping on PPE, and we're not making recommendations that aren't based on sound epidemiology science or CDC recommendations. And I don't think we're going to have to really resort to a lot of alternative things. One thing we were exploring now is recycling of masks. I think last week I used the analogy is if all of a sudden somebody told you you're going to have a shortage of Ziploc bags, you'd put your Ziploc bags in a drawer, so if you needed to use them later, you could. So we're collecting our masks, and then if we need to, we can then use science-vetted sterilization techniques, including ultraviolet light and heat and steam, and time with the 72-hour lag time. So if we have to use the masks, we can. But that's been pretty well worked out by a lot of places now who are further ahead on the epidemic mountain than we are, and they have found it effective. Ventilators here in the Triad region, our ICU bed capacity and ventilators we're fine with right now, we do keep track of that. It's part of our planning for what we call surge capacity, is if we need to start doing and using types of ventilators and things that come out of our storage or out of our stockpile. I guess I could use the word, our local areas, then we can. But right now, it doesn't look like we need to do that. Again, the Charlotte area, I think, is their ICU capacity is smaller, or not smaller, but the number of free beds that they have is getting to a point where they're starting to do more surge capacity planning. I don't think they've put it in place yet, but that might mean cooperating with other hospitals for intensive care unit patients. And certainly I think any and every hospital that has free ICU beds would be willing to help out Charlotte if they needed it. Right now they don't. So we'll see how the epidemic curve goes. So.
When you're talking about, it sounds like it's tight, but you're not at that reusing stage yet. So does that mean if someone needs a new mask, they can go get it? They're not using the same mask every day?
Well, right now, actually, for other reasons, we are using same masks every day, but it's not for the reason that we're short of the masks. It's for the reason that, and this is something that's new, we're just starting to put in place, is that if a person leaves their mask on and keeps their mask on, that it's fine to do so. It's not going to endanger the person wearing the mask or others. But it also means that if you are evaluating a patient and it's not yet clear, say it's an older person where the fever and the cough may be more subtle, and they may be coming in for just feeling really worn out or tired, or they can't get out of bed, which older people, that happens, and you have your mask on and your gloves on already, and you put a mask on the patient, then there's a degree of protection already in place before we start thinking that they might have it. And so it's actually, in a way, safer for our healthcare workers to stay masked throughout their shift. And that's what we're moving to now and trying to get the message out.
So if a patient coughs on a doctor or medical staff and their mask becomes exposed, are you allowed to get another mask? Or do you keep it on?
Yeah, if your mask becomes soiled or torn or not, or worn, yeah, you can get another mask.
So there's not you get one mask a day, you sign it out, and let someone know if you need
No, we don't have a one mask a day, sign it out, no. We have, here's a mask for you to use through the day, and if you need to get another one, you can. Yeah.
In terms of, you were talking about supplies, but what about prescriptions? Has there been a prescription
So prescription drugs, are we having shortages of those? There are a few things that we were worried about having shortages of that we pre-ordered in a timely fashion, including like inhalers and what we call bronchodilators, medicines to make your lungs open up some so you can breathe better. And we have enough of those. Hydroxychloroquine, which is a possible treatment for COVID-19, is in shortage across the country. Our medical system is enough to use for those patients that we think could possibly benefit from it. I don't foresee us running out of that in the near future for these people. But hydroxychloroquine and chloroquine, we have to remember, nobody really knows for sure if these work, and we won't unless there's a big clinical trial. And actually, I think we'll be having a clinical trial here, as far as in a lot of other hospitals in the United States, to try to evaluate it and see if it works. The jury's still out on it.
Can you talk more about that, of what might be happening even within these walls of testing and clinical trials?
Well, a clinical trial means that that you can sign up and give consent to either get hydroxychloroquine if you have COVID-19, or to get an alternative medication for it. And that way we can evaluate and see, does it work, by comparing. So any one medical center couldn't do this alone, because the numbers of patients in any one medical center would be too low to be able to do the statistics to see if there's a difference. And so what we do are large national trials for this, involving many medical centers across the whole country. And we can get the data faster, and then we can do better statistics on it.
So you're engaging in clinical trials?
Yeah, just like, we would. They haven't started here yet, but we hope to have some going in the next few days, just like a lot of other hospitals would too. So we're being partners with other people in the effort.
Can you say who those partners are?
Oh, there'd be over 400 hospitals across the country, so it would be here a long time.
Can we talk about the timeline? There's been a timeline of the University of Washington talking about the peak for North Carolina.
Right. Well, you want me to guess about the timeline of where the peak will come, or do you want to know real hard information?
There's about an April 26th.
April 26th. That sounds a little specific to me. And it's going to be different depending where you live in the United States and where you live in North Carolina, because we have our own individual hill or mountain to climb on the epidemic curve. And when do you get to the peak of that is going to depend on where you are. I think for most places in North Carolina, maybe sometime around the end of April, maybe in May, with a little fingers crossed, okay? Because no one has a crystal ball, and the virus sometimes can throw you a loop here and there, or a left turn. But I think we got a couple more weeks of hill to climb yet, and I'll just leave it at that.
It's a beautiful day outside. I know a lot of people might still be wondering, is it okay to go outside, go for a walk?
Yeah, it's a beautiful day outside. It is. It was a little chilly when I first got up this morning, but it's supposed to hit 65 or something today. Yeah, this is a cool thing to do right now, is enjoy the outdoors, and it is safe. All of the parks, to my knowledge, in the county and the counties around us, are open. So if you want to go for a walk in Tanglewood, go bird watching, sit on a bench and watch some ducks. It's a great time to be outside. Playing tennis, as long as you're social distancing when you play tennis. I don't know about you, but when I play tennis, I spend a lot of time chasing the ball, and that is definitely social distancing. And other activities like that. You go outside, shoot some hoops. You probably don't want to have a basketball game with 20 people in it, and you don't want to be doing activities where you can't social distance outside. But running, jogging, anything like that, biking, it's a great time to do it. And since a lot of our indoor recreation places are closed now, it's a time to get in shape and do it outside.
Do you think we need tighter restrictions?
The question is do I think we need tighter restrictions right now? I would say no. I don't think we need tighter. I'm not sure how we would make it tighter without really getting in the way of normal functioning. Because most of the things that are open, social distancing is very possible. And a lot of our local businesses have really gone to extremes to help with that by placing tables, entrances in one entrance, exit out the other, and hand sanitizer in place. And I think if we can do it safely within the rules of social distancing, cleaning your hands, don't go if you're sick. Don't go to that takeout place if you're sick. But I think we can keep what we have open now open safely. That's my opinion.
Is eradication possible?
Is eradication possible? Yes, it is. Eradication is possible. Is it easy? No. What we would need to do to eradicate it is to get up over the hill using our social distancing and sheltering, start going down the hill, and then put in place a very robust testing, contact tracing, and isolation system, which would mean multiplying the number of people we have in public health to do contact testing by at least tenfold, and then isolating the people identified and having strict isolation. And I can tell you some of the Asian countries where, quote, eradication has been done, such as South Korea and maybe Singapore and other areas, they had some pretty draconian isolation. And the military was involved. So we'll see. The best way to eradicate this will be the development of a vaccine and widespread mobilization and use of an effective vaccine. Am I optimistic about that? Yes. I am optimistic that that'll happen because the natural correlate of immunity, if you're infected, seems to be present. And so I remain very hopeful. Last week I said it would be about a year before we see that vaccine, so now I can say it'll be about a year less 1 week. And Tony Fauci's saying that too, so a good doctor is behind me on that one. The other question I get asked is, what about waves? So if you look at other epidemics, epidemics oftentimes come in waves and have interludes of quiet activity. And that could happen for us. So the summer might be kind of quiet for us, and there may be another wave next fall. Time will tell. We'll see. Usually, the second wave is not as high as the first wave, and we'll see.
So the numbers have been updated, and now it's 56 cases in Forsyth County.
Didn't I say right around 50? I wasn't too far off. Yeah.
So statewide, 1,857.
That sounds about right. Yeah. So we're still going up a hill, more than yesterday. And our hills are all of different sizes, a little bit, and depending on where you live. I get asked about deaths. Yesterday it was 9. I don't know if it's 16 today. So we're well behind the other hard-hit areas. So when you turn on the national news and you see New York, you see LA, you see San Francisco, you see Detroit, which is really getting hit now, New Orleans, which is really getting hit, and you see the deaths there. We're not seeing those numbers in North Carolina. And every death is very unfortunate due to this. But it still is, it is our vulnerable people who suffer the most. people with other underlying diseases, people who are older, who get hospitalized, who might end up in the ICU or who might die. Absolute mortality, the number goes down. Remember when we were saying it could be up as high as 3 or 4%? The number is now down to 1, maybe even a little bit lower, as we find out about more people who are infected who just aren't that sick. The number at the bottom of the fraction gets bigger, the number on the top of the fraction gets the same. So it's worse than flu, but better than a lot of other things I could think of.
And finally, we've been talking about that big number that came out a couple days ago. Dr. Fauci talked about the 200,000 potentially we could die. But here in North Carolina, we have 16. So what can we, as North Carolinians, do to keep our number down?
Yeah, so the number of, so Dr. Fauci and others mentioned the potential of 200,000 deaths due to COVID-19. A few things about that. One, that's over the whole epidemic, including not just this wave, but maybe other potential waves in the future. We'll see. We all hope it's not that high, because that's a lot. That's a big number. Here in North Carolina, so we're at 16 now. It doesn't seem quite as bad as 200,000, does it? But what can we do to keep that number low? One is what we're doing now, is shelter in place and social distancing. Again, I think it's working. I'm pretty sure it's working. So let's keep doing it, and doing it till we get up over the peak, and then we know it's safe to stop. The second thing is keep an eye on your friends and your loved ones. If they get sick with the flu, kind of keep an eye on them. And you can do this using social distancing, between phone calls or saying hi, over distance or whatever. And if they have trouble breathing and other things, then that's when they should seek medical attention.
Is there a patient who has recovered that stands out to you?
Is there a patient that's recovered that stands out to me? Yeah, some of which I know personally from my interactions and being one of the infectious disease doctors here. The other is people that I might see on the news or in the newspaper. And 85% of people are going to be fine with this, and it's really only 10 to 15% of people who are going to end up having to be in the hospital. So for any one particular person, that's a pretty low number. But for a big community like Charlotte, those numbers add up, and that's why we're seeing what we're seeing now.
Dr. Roll, got a couple questions from reporters who couldn't be here, but they were on.
All right, this one's for the reporters who couldn't be here. All right.
Can you speak about how Forsyth County ranks in the state as far as the number of tests that have been done?
So here in North Carolina, how did the number of tests that we have done rank in the state?
Forsyth County.
Forsyth County itself. So we've tested, the absolute numbers are a little bit hard to come by, actually. It's probably a little bit less than 1,000 people in Forsyth County. Compared to the rest of the state, obviously it's lower. We're 1 out of 100 counties. And we started talking here about letting people go home and have their flu without testing early on. And so our numbers might be a little bit lower than some other areas. And again, I'd like to reiterate, not everyone needs to be tested. If you got the flu and you normally stay home with the flu, you don't need a test. Stay home with the flu.
And then is there anything you can explain when people are told to just go home and they're not given the test, they're told to go home and isolate? How is the county able to make an accurate count?
So if we're not testing people and we're telling people just to stay home and isolate for your I call it the 772 rule, 7 days at home with 72 hours of symptom improvement. How do we keep track? How do we know where we sit? Well, we have other ways, one of which we look for influenza-like illnesses in our sentinel clinics, we do this every year for the flu. and we can keep track of our percentages who have flu-like symptoms, which right now is a pretty good estimate. The other thing is we can look at hospitalizations, because the peak of the tip of your iceberg, that 1/7 of the iceberg is above water. So if you look at those numbers being hospitalized, you kind of know how big the iceberg is underneath it, and then I guess then you can steer your ship away from it, right? As long as you know to estimate the iceberg. So those are some of the things that we're doing, and we'll continue to do, and that's what the state is measuring too.
And then finally, anything you can speak about the accuracy of the test?
Yeah, so the accuracy of the test is very accurate in that, well, there's a lot of things about tests. How sensitive is it? It's extremely sensitive. It'll pick down to 10 copies of RNA. That's that little molecular thing that we learned about in high school biology, right? And 10 copies is not very much. And in fact, it's below the level that is infectious to other people. So we can the test is actually more sensitive than what transmission would be. Accuracy is a little bit of a different question, because it comes down to how well does the test work in different populations. So pretty well, actually. The one we use in the United States works pretty well. And so for most populations, a negative test is negative, and a positive test is positive. Now, if you start testing people who have absolutely no symptoms at all, it's a little bit harder to know, because a negative test doesn't mean you won't get it, and a positive test doesn't mean you will. And so if you don't have symptoms, and that's why we're saying let's not test asymptomatic people except in some very well-defined close populations, like a cruise ship, which you shouldn't be on right now.
Any final words of encouragement?
Final words of encouragement. Yeah, it's a beautiful day. Let's get outside. I've enjoyed my time out here talking with everyone. We're going to get through this. Every day is another day that we've climbed up the hill. I think in some areas I can see the top of the hill. Seattle are starting to look like they're at peak, and some of the communities that initially were. Northern Italy, which has had a devil of a time, is some of those northern cities are starting to see that they're maybe at the peak or even starting to come down. So it is a hill. Going up the hill's hard. Coming up over the top, hopefully it'll be easier.
Thank you.
You're welcome.